Which of the following is not a cause of microcytic anemia? The right option is delta, pancytopenia. The lab reports for a patient with low mean cell volume show high serum ferritin and low total iron binding capacity. What is the most likely cause for this patient's anemia? The right option is beta, anemia secondary to inflammation. Iron is absorbed in the right option is beta, duodenum. Where is most non-heme iron found in the body? The right option is beta, bound to transferrin. Select the following that enhance iron absorption. The right option is delta, both B and C. What is the most important test for iron stores? The right option is Charlie, serum ferritin. Which of the following is not an etiology of iron deficiency anemia? The right option is Charlie, infection. TIPC increase in iron deficiency anemia because the right option is Charlie. Ability to absorb increases. TIPC stand for total iron binding capacity. PICA, a clinical presentation for iron deficiency anemia is. Right option is Charlie. Desire to eat weird things. Which lab investigations would you order if you suspect iron deficiency anemia? The right option is delta, all of the above. CBC, blood smear, serum iron. Right option is delta, all of the above. Where is beta thalassemia most common? The right option is delta, all of the above. What is the difference between beta thalassemia major and beta thalassemia minor? The right option is alpha, homozygous versus heterozygous. His bodies are made of. Right option is beta access alpha chains. Which would you expect to see on a blood smear for beta thalassemia? Right option is delta, all of the above. What is the treatment for beta thalassemia minor? Right option is delta, none of the above. On a CBC for alpha thalassemia, you would see anemia and reticulocytosis. On blood smear, you would see Heinz bodies, hypochromic microcytic cells, and occasional target cells. Select the others that you would see increases. Right option is delta, all of the above. Aplastic anemia can be acquired and inherited. What are some of the ways it can be acquired? Right option is delta, all of the above. Aside from the gradual onset signs of anemia, what other clinical presentations would you see with aplastic anemia? Right option is delta, all of the above. How would you diagnose aplastic anemia? Right option is beta, bone marrow biopsy. Select treatment option for aplastic anemia. Right option is delta, all of the above. A diagnosis of Hodgkin's disease was made to a 58-year-old man and is admitted for the initial cycle of chemotherapy. During the hospitalization, the nurse should watch out for the following complications except. Right option is beta, benign prostatic hyperplasia. The nurse is reviewing the chart of a client who is newly diagnosed with chronic lymphocytic leukemia. Which of the following laboratory values is expected to be seen? Right option is beta, thrombocytopenia and increased lymphocytes. Maria was recently diagnosed with Hodgkin's lymphoma. Upon the early diagnosis, the nurse will expect which of the following areas is often involved. Right option is beta, neck. According to a standard staging classification of Hodgkin's disease, which of the following criteria reflect stage 3? Right option is alpha. Involvement of lymph node regions or structures on both sides of the diaphragm. Angela, our clinical instructor, is conducting a lecture about chemotherapy. Which of the following statement is correct about the rate of cell growth in relation to chemotherapy? The right option is alpha. Faster growing cells are more susceptible to chemotherapy. A 40-year-old male diagnosed with acute lymphocytic leukemia finished his first cycle of chemotherapy. Which of the following statements by the nurse is wrong? The right option is Charlie. Try eating sashimi is one of the famous Japanese restaurants around the city. A client with leukemia has neutropenia. Which of the following functions must be frequently assessed? The right option is Charlie. Breath sounds. Which of the following clients is most at risk for developing multiple myeloma? The right option is alpha. A 60-year-old African American man. Which of the following substances has abnormal values early in the course of multiple myeloma? The right option is immunoglobulins beta. Nurse Andre is caring for a client with multiple myeloma. During the review of the laboratory results, the nurse will monitor the client for which of the following conditions? The right option is delta, hypercalcemia. Which of the following may be an underlying condition that leads to DIC? The right option is delta. All of these conditions could lead to DIC. Nausea and vomiting are common adverse effects of radiation and chemotherapy. When should a nurse administer antiemetics? The right option is delta. 30 minutes before the initiation of therapy. Sickle-shaped erythrocytes cause delta, all of the above. A person with sickle cell trait would. Right option is beta. Be protected from crisis under ordinary circumstances. On the basis of the knowledge of the inheritance of sickle cell gene, the nurse expects the patient to be of what descent? Right option is alpha, African. On assessment, the nurse notes that the patient's face and skull bones are enlarged. She knows this is a compensatory response to. Right option is beta, anemia. The nurse is caring for a female client experiencing neutropenia as a result of chemotherapy and develops a plan of care for the client. The nurse plans through. Right option is alpha. Teach the client and family about the need for hand hygiene. Choose the hemoglobin level in the newborn. Right option is delta, 180 to 240 gram per liter. Choose the most common cause of iron deficiency anemia in early childhood. Right option is beta, nutritional factor. Choose the laboratory result that is not characteristic for iron deficiency anemia. Right option is delta, decreased total iron binding capacity. Choose the factor that increase the iron absorption from oral iron supplements. Right option is delta. Characteristics of iron from oral iron supplementation preparation. Select the food from which iron is easier absorbed. Right option is alpha, meat. Choose the feature that is not characteristic for B12 deficiency anemia. Right option is delta, increased serum iron level. Enumerate diseases that determine reduced iron absorption in the gastrointestinal tract. Right option is alpha, cystic fibrosis. The nurse is caring for a female client experiencing neutropenia as a result of chemotherapy and develops a plan of care for the client. The nurse plans to. Right option is alpha, teach the client and family about the need for hand hygiene. Which of the following is a defining characteristic of anemia? Right option is delta, hemoglobin less than 12 gram per deciliter for women and less than 13 gram per deciliter for men. One of the following which is the most prevalent cause of anemia in the elderly? Right option is delta, chronic disease inflammation. What is the most common cause of iron deficiency anemia in the elderly? Right option is gastrointestinal blood loss. Pernicious anemia is an autoimmune disorder that causes. Right option is Charlie, vitamin B12 deficiency. Which of the following are good food sources of folate? Right option is beta, liver and beans.